My name is Daphne Hart. I'm a family physician living in Smithers, and I have a contract with Northern Health to help people living with HIV access medical care. I think the thing that's changed is there's two big things, and one is the idea that it's a chronic disease, and it's a manageable disease. It's a disease that you can live almost a normal life expectancy. That is a very big change. And the other big change, which is in the last couple of years, is the whole concept of treatment as prevention. That's very big. And I think the other thing that's changed for us here in Smithers is I've been doing this work, I've had a contract with Northern Health for 10 years. And in the beginning, physicians were quite, tentative and not fully comfortable with providing primary care to people with HIV. And it just seemed like a huge sort of mysterious body of knowledge. But that's definitely changed. The physicians that are in practice here, a number of them are younger and have learned about it in their basic education. I'd like to think that some of the information that we've provided to physicians has made a difference. And the Center for Excellence in HIV and AIDS has just published in March 2011 primary care guidelines. So there's no longer any mystery to family doctors what they're meant to be doing. I'm not talking about the treatment protocols that have been around for years, but I'm talking about primary care treatment guidelines, so doctors know what to do. And I think that they're feeling increasingly comfortable to do it. So that's a big change. I can tell you something else has changed over the years.
Sure, love it.
So last year, last calendar year, 2011, there was a HIV collaborative, a provincial collaborative, Impact BC, provincial government, Centre for Excellence, and all the health authorities. And there were teams all over the province that were sort of developing things to improve the system of delivery of care with, the financial and other kinds of support from the health authorities. So I was on a Northern Health team, but we also had a Smithers team, and there was myself and one other person, Leon Hodge-Johnson, and we developed 4 objectives, and they were actually, it was my wish list. It was the things that I had seen over 10 years that we really needed to be able to do better, but how do you make it happen? And then all of a sudden along comes this collaborative, and so we worked on the wish list, and one was to bring primary care guidelines home, and we did. A physician from the Centre for Excellence, Sylvia Golimi, came up and presented them to a large number of physicians and other healthcare professionals in June. We also wanted to have patients get access to specialist care and to pharmacist care by telehealth, by video link, because traveling to Prince George is one of the things that's in the way of accessing care. And that there's nothing in the system that provides pharmacy-based care for people with HIV. Things are mailed up from down south kind of thing. So in this collaborative, one of our objectives was to set up video link with a pharmacist who had been hired in Prince George. She's Jennifer Hawkes is the Northern Health HIV pharmacy clinical specialist. And so we've had people get video links and have that conversation with the pharmacist, talking about side effects, talking about what to do if, and also that was started in July. And then in September 2011, we had the first video link with Dr. Abu Hamar, who's a specialist in Prince George. I think first visits are best done face-to-face, but then people don't have to drive. Travel is hard if you don't have a car and you don't have money and you're dependent on a system to help you get there. So that's a huge bonus. And then the last thing that we accomplished, and I think this comes back to the very beginning, the fourth wish was to have team-based care. Because, that what I said when I came back and I realized that I was felt fairly knowledgeable about HIV and thought I was going to find a very enthusiastic, receptive audience, and they had bigger problems. And so what I realized was that I can help them with the medical care. The family doctor can help them with the medical care, but it takes a team of people to help with all the problems that people have that are in the way of accessing care, and being adherent to treatment. So we had a meeting here in November of everybody that we knew was involved in helping people with HIV. A couple of physicians there, but mental health, social services, public health, pharmacists, and positive living, of course, and various other kinds of representation. And it was basically for all the people to meet and greet, get to know each other, and talk about what they do, talk about a little bit about the problems that they have in doing what they'd like to do. And then we created an inventory at the end. So I think that was really quite helpful. Like, say, from a physician point of view, the physicians would know who else is out there and who to call, what's their name, what's their phone number, what's their email address, or I should say their website. The other thing I tell you that's been really helpful here is the pharmacists have voluntarily helped. Medications don't come through the commercial pharmacies, but when the commercial pharmacy at PharmaSave in Smithers knows that people are on other medications and they could dispense the HIV medications with them, so there would be more chance of them being adherent, or most specifically, if they're on methadone, that they're dispensing the methadone and they get the HIV medications with that. And they have done that, like they have voluntarily made that happen. And I think that's been that's another thing that's changed and been really important locally.